Time is for 10 minutes, 1 minute for candidate instruction and 9 minutes for your performance. Is that okay?
Yes, okay.
Okay. You have to describe each and every point for your station. If you need help to ask any question, just ask me. I'm the patient. Okay.
Okay.
Okay. Time start from now. 1 minute for candidate instruction and 9 minutes for your performance. So I'm sharing my screen for your scenario. Can you able to see the scenario?
Yes. 25-year-old gentleman was involved in a road traffic accident. He was found to have a large pneumothorax and a chest X-ray. Please perform a relevant procedure.
Okay. You should have some mental preparation for next 30 seconds and then we can start.
Okay.
Okay, you can start now.
Okay. Hi, good evening. I'm Dr. Srivanatha, treating doctor for you today. May I confirm your name and age?
Hello, doctor. My name is John. I'm 25 years old.
Okay, John. I have been asked to put a tube in your chest. Is that okay for you?
Yes, doctor.
Okay. So, do you have any medicine allergies?
No.
Okay. And I'm preparing the equipment and I'm draping the patient and giving the local anesthesia of lidocaine at the mid-axillary line at the 5th intercostal space.
Okay.
So, and I'm cleaning the part with the betadine, and now I'm giving a lidocaine injection of 3 mg per kg.
Okay.
So lidocaine is given.
Mm-hmm.
So I'm now waiting for 3 minutes. Okay.
Okay.
Do you have pain now? I'm pricking the skin.
No, doctor, no pain.
Okay. Then using a 11 blade, I'm making a small incision in the skin.
Yes, doctor.
And the 15 intercostal space. So then I'm dissecting it through my finger, through the forceps.
Okay.
Then dissecting the respiratory muscles through my fingers, 2 fingers.
Mm.
And now I'm reaching the parietal pleura.
Yeah.
Okay. Then I found a space, pleural space, and I am now inserting the securing the pleural space with one finger of my non-dominant hand, and now inserting the chest drain tube with the help of artery forceps.
Okay.
And now inserting it upwards medially.
Okay.
And I am ensuring. Hello.
Yes.
Yes. I have inserted the chest drain tube and now ensure the water underwater seal and ensure the air swing, and now doing the pulse purse string suture around the chest drain side to secure the chest drain. And the suture is done, and now removing the drapes.
Anything else you want
Thank
to do? Do you finish your station?
Yes.
Okay, can you please tell me the boundary of safety triangle?
So the boundary of safety triangle is anteriorly lateral border of pectoralis major, posteriorly the anterior border of latissimus dorsi, and in the apex is axilla, and the base is a line connecting between the latissimus dorsi and the pectoralis major.
Okay, can you please the local anesthetic doses for this patient if the patient is 70 years old?
Okay.
Sorry, 70 kg.
So for 70 kg patient, I will give 3 mg per kg without adrenaline of injection lidocaine. So for 70 kg patient, I will give sorry.
Yes, tell. How can you calculate?
3 mg per kg into 70 kg.
Okay.
So that's can be up to 210 mg.
Okay. Okay, thank you for your participation with this mark. You have 3 minutes time. I think when you are doing this in this station, it will take at least 9 minutes. Okay. Let's go for discussion for 25 years old gentleman who involved in a road traffic accident and found with large pneumothorax on the chest x-ray. So you have to do chest drain. So the first very thing is introduction. So before that, what do you think? What your mistake? Can you identify any mistake?
I missed the wash hands before entering the station, and I missed wearing a sterile glove.
Okay. Okay. Before that, let's go through the station so that you can understand what is going on. Okay. Okay, that's fine. So the very first thing is wash your hand, introduce yourself, check the patient details. Did you check the patient details and consent? Consent?
I got consent.
Written and verbal consent?
Confirm.
Did you
confirm patient name?
No. You have to offer patient that you need to sign in a consent form for this procedure. Is that okay? You have to offer. Okay?
Okay.
Just offer, just you'll get the mark through checklist. And then explain about the procedure. Did you explain about the procedure?
Yes.
Okay. So you can ask for an assistance for this procedure because you can't do alone for each and everything. Did you check WHO checklist?
No.
Okay. For WHO checklist, you have to check proper patient, proper site, proper position, proper timing, everything. Okay. So just check his bracelet or hand wrist, any point of ID name, his name, and match it with his document. So you can offer that. I would like to check WHO checklist. I mean, patient name, age, details on bracelet as well as in the document. Okay. So if you miss WHO checklist, you lose your mark. There's the introduction portion. Okay, wash hand, introduce yourself, check patient details, consent, explain about procedure, ask for assistance, and WHO checklist. These are the part for introduction. If you miss any point, you lose your mark. Okay. Next point, the preparation. While you are doing preparation, you have to keep in mind for few points. What are the points? Draping, sterility equipment on a tray, check local anesthesia, check allergy. I mean, did you check the date of local anesthetic agent as well as allergy?
I missed it.
Okay. no problem. And calculate local anesthetic doses also. So you have to remember all the time because examiner may ask anytime. These are the preparation portion. The next thing is procedures. So for the procedure, did you check the chest X-ray or offer or ask any chest X-ray available? No.
No.
Did you check the position of the patient, whether it's 30 degree with hand behind their hand?
No.
No. Did you check the vitals? I mean, pulse oximeter, oxygen saturation, and other things?
No.
Did you wear sterile gown and gloves?
I supposed to, but I
Okay,
forgot.
okay, that's fine. I agree. Clean with iodine or chlorhexidine and wrap?
Yes.
Okay. And local anesthetic to peristernum on the superior border of the ribs to avoid the damage of the neurovascular bundle. Okay. So then wait for a few minutes, you did that, and then test the skin before insertion, you did that. And insertion the superior border of the ribs, always remember that. Then blunt dissection, you did the blunt dissection through the muscle and parietal pleura. You have to clamp the drain or using hemostat or clamp to guide tube placement upwards for pneumothorax and downwards for hemothorax. Usually it's for pneumothorax, so it should be upward. And stitch suture to hold the drain, attach drain adequately filled with underwater sealing system with a tube connector. Okay.
Okay.
And then observe bubbling with respiration or ask the patient to cough. You can check that, but do each and every point rapidly. You have to remember each and every point so that you can't forget the point. You understand? You get my point?
Yes.
Okay. So the next thing is procedural. You finish the procedure, but the important point is candidate most often miss the post-procedural advice. So you should apply a dressing, discard sharp in a sharp bin, put clinical waste in a proper bin, thanks the patient, post-procedural advice, and discuss warning sign. Did you discuss warning sign?
No.
No, you should discuss any blood come out, any pain, any swelling, any temperature. You should contact with this. You should check. Did you order chest X-ray or ABG?
No.
No. And then did you document the procedure?
No.
And then we can go for next this triangle of safety, you know that. So these are the things you should remember for each and every time when you are doing any procedure. So for any procedure skill, the first thing you have to remember introduction. So the checklist is important. The examiner never give full mark for your procedure skill. You can do good job for chest drain or maybe nevus excision or maybe abscess drainage, but the marking depends upon your approach and step. So step is important. Procedure is not important. What are the steps? So you should follow each and every step, and they have checklist. If you miss any point, you lose your mark. You get my point?
Okay.
Okay. So hopefully you'll understand how to do chest drain and how to approach for procedure skill.
Yes.
So what do you think before doing procedure and after discussing these things, you miss several points. Do you think you learned something from this discussion?
Yes, I learned something from this discussion. Before doing procedure, I thought completing the procedure would suffice to get marks. But after the discussion, I realized that a lot of steps has to be done to gain complete marks.
Yeah, that's true. Thank you so much for your participation. Hopefully you'll join our next free mock session for next week. May I ask, when will you exam?
My exam is in Jan 2024.
Which center?
Hyderabad, India.
Hyderabad, India. Okay. Okay, no worries. Keep in touch with us. We'll try our best to support you up to your exam. So thank you for your participation. So I'd
Sure.
like to close the session now. Thank you very much. I'll send the recording in the group later.
Sure. Thank you very much. Great session.
Okay. Bye. Take care.